One nurse, when I first started, said to me, "Oh, we need to train you because you're getting taken advantage of and you need to learn, the tricks." And I said, "What do you mean by that?" And she said, "First rule is never make eye contact with a patient." I was horrified because that was why I was there.
Right.
I said, "What do you mean by that?" And she said, "Oh, if you look at them, they will ask you for things." I said, "But they're patients, why wouldn't they?" When I first got there, it was like something out of a horror movie. I'll never forget it. Friday night, Saturday night, Cape Cod Hospital. I would get there after 6 p.m. The bays, the holding areas were loaded with patients that had already been admitted from an electronic standpoint and clinical,
Yeah.
but there was nobody to transport them. And so they were non-telemetry patients that a volunteer was allowed to just literally bring their stretcher with their belongings up the elevator to the inpatient beds. It was always a mad dash. It wouldn't be unusual to have 8 or more of those patients waiting when I would come in at the start of my shift.
Wow.
And so that would be the first thing I would do. But what I would observe is that as soon as I would get in the elevator and the doors were shut, then they would tell me stories. Oh my God. They said it was as if they were ignoring me. Nobody would look at me. "Oh, I'm so sorry that happened. It was a busy night in the summer." I would try to tell them that was an aberration when I knew it wasn't.
Yeah.